Patient hospital discharge readmissions has become a major problem for the healthcare industry. Almost 20% of patients have adverse events within 3 weeks of being discharged. In the US, nearly 25% of discharged patients are readmitted to the hospital within 90 days. Unplanned readmissions costs billions. Hospitals are fined for having high readmission rates. Due to pressure from Medicare and other payers, patients are being discharged as soon as possible. They often return home with little or no professional assistance. Complex care falls under the responsibility of family members who have no training. The most common post-discharge complications are an adverse drug event, ADE, infections acquired in the hospital, procedural complications, as well as pneumonia, depression, and loneliness. Welcome to a new era of healthcare at DynoSense, an integrated ecosystem of patient remote health monitoring. Health Relationship Management Services helps to decrease hospital readmissions and provide anywhere, anytime monitoring, diagnosis, and prevention. Before being discharged from the hospital, patient is given a system that will monitor his condition during home recovery and keep him connected to doctors and caregivers anytime, anywhere. This system reads patient's data and immediately sends this raw data to the cloud that can be accessed and interpreted by a caregiver. If there is a change in the patient's health data that requires immediate action, the patient is contacted to see what might be causing the change. By actively observing personal health data, patients are encouraged to become involved in their health with user-friendly access via friendly portals called DynoLife. Patients are provided with outbound motivational messages, reminders such as medication reminder or health tips, and opportunities to further engage in their own health care. For the isolated patient, the interactive app will provide an outlet to the outside world, which may limit a sense of loneliness and isolation by discussing health issues with others. By having a doctor nearby, any health alerts will be immediately followed up on, so patients can avoid readmission to the hospital.